Great questions, and we're going to talk with an expert about it here in just a second. John, are we going to go to... Okay, that's what I thought. We're going to bring in Dr. Amish Adalja right now, senior scholar at the Johns Hopkins Center for Health Security. Doctor, thanks for joining us again. So this changed just since the last time you and I talked. You saw what hospitals are doing right now. What are the challenges ahead until this vaccine actually gets injected, possibly on Monday?
The challenges are now waiting for the CDC and ACIP to meet on Sunday and make a decision about how they actually want to roll this out. What age groups are going to be included? Are there going to be contraindications for those people who have, for example, severe allergies like we heard from the UK? All of that's going to happen next, and then it's going to be actually implementing the rollout. So hospitals are going to be allocated a certain number of vaccines. It's not going to be their whole staff, and they have to decide at a hospital level, who of their frontline workers are they going to vaccinate first? Are they going to vaccinate and everybody with one dose and then wait for a second dose to come? Or are they going to kind of spare back half of the doses? A lot of logistical challenges, that's what's going to happen. And I suspect also that you're seeing right now probably the Pfizer plant in Michigan shipping doses to hospitals and to other sites right now. So there's a lot of activity that's going to be going on. And this is the beginning of what's going to be a long process that will eventually end with the pandemic, but not being a public health emergency anymore.
And I want you to kind of stress that point, Doctor. As always, thank you for being with us. When we talk about it being a long process, as you just said, there's still a lot of unknowns, a lot of questions out there, but realistically, from your experience, this tonight begins a process that you think will last how long to get enough Americans inoculated that we can safely say the COVID is at least largely behind us?
I think we're looking probably at 5 to 6 more months of really trying to get this vaccine into people's arms. We're probably thinking spring, late spring, early summer before we cross that herd immunity threshold. Obviously, if we get nursing home residents vaccinated to high levels, we're going to see pressure immediately be relieved off of hospitals once we hit that herd immunity threshold in nursing home populations. They're part of the first tier, so we may start to see in the next several months a change in the perception of the risk of this disease, because we'll have hospitals not being worried constantly about their capacity on a day-to-day basis, and we'll find healthcare workers much more comfortable taking care of patients as they become vaccinated.
Dr. Pfizer and BioNTech shattering records by developing this vaccine in just 11 months. This is obviously great news, but you can understand why a lot of Americans are reluctant to get a vaccine that they don't know a lot about because it's so new. They're worried about effects down the road, 1-2 years from now. What does the messaging need to be to those people?
Well, we need to talk about what happened in the phase 1, 2, and 3 clinical trials, what we saw in preclinical studies, animal studies, and other work with the technology in this vaccine, messenger RNA or mRNA vaccines. And it's not a surprise that it was done this fast, because many of us in the field have been talking about the promise of messenger RNA vaccines to really change the way we dealt with infectious disease emergencies and get a vaccine candidate into clinical trials very quickly. You have to remember that there wasn't any kind of skimping on the safety studies. Where the speed was achieved was actually going from identification of SARS-CoV-2, the cause of COVID-19, and the development of a vaccine candidate. Then the clinical trials occurred. And anytime we have a vaccine, we don't have all the long-term effects when we license that vaccine. We follow people who get vaccinated for years. So this isn't anything different than what happened with other vaccines, other than we harnessed a new technology that allows us to kind of have a 21st century approach to making vaccines. I think we have to be proactive with this information and very transparent, because we want to make sure that as many people that are eligible to get this vaccine get it, because that's the quickest way we put this public health emergency behind us.
Let me piggyback on that, Doctor, because for people who are nervous or maybe hesitant about this thing, we will learn a lot over the next 2 or 3 months as this vaccination goes into the arms of millions of people worldwide. It'll sort of be a rolling, continual trial that we'll all be watching on the fly, correct?
Right. You have to remember that clinical trials, even though they're robust and have tens of thousands of people, don't necessarily have the ability to pick up side effects that might be happening in 1 in 1 million people, for example. And when we roll this vaccine out, and it's not just the United States, there's 5 other countries in which this vaccine has been approved, you're going to see millions of people, hundreds of millions of people eventually, and billions of people as we vaccinate the world. So you do look and see what are the rare side effects, and you get a better picture of it. But looking at this right now, you have to make a risk-benefit decision. This is a disease that is killing 3,000 people a day in the United States, more than Pearl Harbor. And we know that this vaccine has done very well in phase 1, 2, and 3 clinical trials. So the risk-benefit ratio greatly favors the vaccine for those people who are eligible to get it. So I think that's why what we have to stress. We want this public health emergency behind us. And as I said earlier today, I would be happy to have the vaccine today, and I will likely get the vaccine next week, hopefully.
And Doctor, one of the fascinating parts of all this that we're going to see play out over the next few months is this prioritization process. I think everyone understands frontline medical workers, they're going to be the first in line, the elderly population, long-term care workers and residents there. Once we get past that first wave, though, who is going to make decisions in terms of who's next in line? Some people saying, well, school staff should be next to get the kids back in school, to free up the parents and get that part of life back to normal. Who's going to make those kind of decisions, and what should, in your opinion at least, be the order after this first wave about who gets it and when, so there's just not a national stampede to the local doctor's office or a pharmacy?
It's important to remember that this has already all been articulated by the CDC's ACIP, their Advisory Committee on Immunization Practices. So after we get through phase 1A, which is healthcare workers, nursing home residents, we move to the next phase, which is essential workers. And essential workers are going to vary from state to state because states will have latitude to decide who is an essential worker. Obviously, it's going to be people like law enforcement. It may be some political leaders that are in charge of running the government. It could be teachers, and I think it probably should be teachers considered as essential workers. To get our schools back open, people who work in food processing, people who work in grocery stores, drivers in the transportation industry, all of those are going to be the next group, that essential workers, the people who keep our world the way it is, keep our economy going, the armed forces, all of that will probably be next. And then it will be community dwelling, high risk individuals. So that might be the 65-year-old patient with diabetes who live not in a nursing home but lives at home. Then that will be the next tier, and then after that will be the general public. That's the general blueprint that the CDC has laid out for how this vaccine will be rolled out. We'll hear more about it in the days to come.
Where do TV anchors fall on that list? Just asking for a friend.
Depends on your age and your risk factors for severe disease.
Appreciate
He's going to
that.
answer us seriously. He takes your questions
He
seriously.
did.
Doctor, I just want to ask you on a personal level. Obviously, it's been a rough year for all of America and the world over. But as a healthcare worker, you have such a unique perspective, and you all have been through so much more than any of us can imagine. So when you heard the news, obviously it was expected. But how are you feeling right now to know that this is the beginning of the end?
I think it's a good feeling. And not only do I take care of patients, I work in pandemic policy. So I'm somebody that's been trying to figure out better ways to make our country more resilient to pandemics and infectious disease threats. And I do think that vaccines are the ultimate solution to infectious disease problems. And to see a vaccine be made this rapidly using new technology, and what this means for the future, for our next threat, and how much better we're going to be prepared, that's what gets me even more excited than what's going to happen with this pandemic, because I do think this is going to change the face of the way we deal with infectious disease threats. And COVID-19 is going to come and go, and we're going to have another pandemic threat or another infectious disease emergency. And all that we learn here is going to make us so much better to respond. But I do think, I am excited to get vaccinated. I get excited about vaccines because I'm an infectious disease doctor and I like to be vaccinated. So I do think that this is going to be something that will get us back to some semblance of normalcy. But we have to remember that there's going to be dark days ahead. The next 90 days or so may be very critical in terms of how many people are going to die from this. And this vaccine isn't going to measurably impact that. So even though it's kind of a tempered, measured enthusiasm for where we are, but the vaccine is unequivocally a great step forward for science, for medicine, and for controlling this pandemic and preparing for the next pandemic.
And certainly the best news we have heard in months. Dr. Amish Adalja, again, thank you so much for answering our questions tonight and bringing a lot of information to the table and to our viewers. Thank you again, sir.
Thank you.
This is Dabu7. We have the newest reports out of the UK stating that a rapidly spreading strain of this coronavirus has been identified in England. They're saying that this adds more than 1,000 cases to the UK's total count. Now, we've been waiting to get some updated, official, solid numbers this whole time, not only in the UK, but in the United States, globally. So right now, if you don't know, London is entering the top tier of this tiered system they have them under. throughout all this. Now, this new variant, they're saying, has been located in southeastern England. This all comes from Matt Hancock that released this information here today, saying that scientists at Porton Down, the country's secretive military and public health research facility, they have been analyzing this new form of the virus. All of this being put out there without anything to see to try to go and verify anything on. With their initial analysis here suggesting that this variant is growing faster than the existing variants or the strains that were out there this whole time throughout the year that they had been talking about, that we've been waiting to see these controlled placebo studies on, as well as a whole lot more we've been waiting to see in terms of all this as well. And if you don't know, these vaccines being rolled out are different in different areas. Just like Russia's will be different than what you're seeing rolled out here with Pfizer and Moderna in the United States, so on and so forth. But with them making the statement that they have this new strain, well, this can change things in terms of how they're going to do a lot. So it just gives them a reason now to clamp down even harder at the very top of this tier. Heads up, folks, I'm going to break this down, what it all means. This is Dabu 7. Warp speed begins. For those that missed it, the man that's been put in charge of rolling this whole thing out, Perna, took the video, and in the clip that was released, he has said that this is D-Day. And as you can see here, Trump says the first vaccine administered here in the United States, they're saying that a doctor and a nurse in New York are the first Americans to receive the Pfizer vaccine. So it begins. It all goes into motion here. They're saying the rollout of the first 2.9 million doses have already gone into motion here. So they began to roll out Sunday, departing from the plant in Kalamazoo, Michigan, where they had made several different stops in different distribution spots, and then they were shipped out to these different areas. You're going to have to look into what your city, your town, your business has planned in terms of this, because every state, every city is going to have a little bit of a different rollout for people wondering what's going on. Every country is going to be different. Some could sit there and try to do the mandate thing. Others are not. As I said before, most are being slick about this. They're not going to mandate anything. They're just simply going to say on the other end, you can't go to the theater, you can't go to the bar, you can't go to the restaurant, you can't go to the fights, you can't go to the ball game, none of it. The concert, none of it. Until you can prove that you've been vaxxed. That's what's coming. I hope you see that. I hope you realize where we are. I'm going to break this down further, what this all means, on the next live stream. Make sure to join me tonight.